No, your therapist is not in love with you. Please don't ask them that. And don't ask them a whole bunch of other stuff too. Actually, try not to ask. Therapy has limits.
The limit does not exist.
It has boundaries. It is a professional relationship. The therapist is highly trained, at least they should be. They're credentialed, they're licensed. They're not doing this work because they just want to tell you their personal takes on things. That's not what therapy is. Hi, I'm Dr. Katie. And should I say my last name too? Katie Brzozowski. I am a therapist. I own my own private practice. I have a doctorate in clinical social work from the University of Pennsylvania. I taught full-time at the university level for 10 years. It's great that so many people are going to therapy, but not everybody knows what therapy actually is. And so they're just excited to be able to have this relationship with another human. And so the boundaries can get pushed a little bit. And we don't want that to happen. These are 3 questions from my experience that you should not ask your therapist. Question 1, am I your favorite client? So you wouldn't ask your cardiologist or your dermatologist if you have the best heart or the best skin out of all of their other patients, right? Like that wouldn't make any sense.
I had the best word.
You come to a therapist because you're trying to get help with something, right? Trauma, you're just having difficulty in relationships, you're going through grief, or there's a bunch of reasons you would go to therapy. But you're going to therapy for a specific purpose. Just like you'd go to a cardiologist because you have a heart problem, or you're going to a dermatologist because you have a spot on your skin or something like that. You're not going to get any more information by asking us, am I your favorite? See how you feel in therapy. If you don't feel connected to your therapist, then you find a new therapist. But if you feel connected, don't ask if you're your favorite client, because I'm not gonna answer it. You might be my favorite client. One, we're not really supposed to have favorite clients, but we're people, so we probably do. You know, of course, there's people you like on the street and the people you don't like on the street. You're gonna meet people in therapy the same way, but we're still doing a job. We're still gonna have a good therapeutic relationship with our client regardless. I mean, I understand you want to know, but it doesn't matter, and you're just gonna stress out the whole situation. You're gonna end up spending valuable time from your session on this thing that's just not gonna get you where you wanna go. Mm-hmm. Okay, question 2, if I wasn't your client, would you date me? Please don't ask this. This has been asked of me. There's no way that your therapist is going to answer that honestly. There's no way. If you ask them that, they're going to lie, because either they would date you, they're not going to. That ship sailed because they're your client now. So even if you're both single and it would be perfect, they are your client, that relationship can't change now. It's not ethical. It's not ethical to okay, stop being my client and now we'll date. That's not allowed. We will talk about that later because that is a whole thing. You can't date your therapist. But what if you wouldn't date them? Then you're gonna cause trouble, right? Because you're saying, no, like you're not good enough for me to date. That's crazy too.
Why am I not good enough for you?
I hate it. Please don't ask your therapist that. And also, the answer's no. Okay, and question 3, have you ever cheated on your husband? Or something else bad, gotten blackout drunk? There's some things you just don't need to know. Someone asked me once, have you ever cheated on your husband? Incidentally, I hadn't, but the point isn't that. The point is, how do you answer that? So if I said yes, I had, now she knows way more information about me than she should. You know, there's doctor-patient confidentiality, but it doesn't go the other way. So she can go tell anybody anything she wants about me. So you want to be careful also what you disclose about yourself. But either way, so I tell her yes, and in that case it would have been a lie. Or I tell her no, and then,
oh, well, she couldn't possibly understand my situation.
Or, you know,
does she think she's better than me, or she's more moral or more ethical or something?
It just doesn't make any sense to ask those questions. Yes, certainly therapists will use lived experience, but you need to do that intentionally. You can't just be talking about your life. We're not inspirational speakers. We're not sage advisors. We're not here to tell you how to live your life. So I think just asking that kind of personal question, I don't think it's gonna help your therapeutic process. So thanks for watching. If you liked it, then watch our other videos because I have a lot to say. I can't wait to say a lot of things. Make a lot of videos.
That's